All right, so we're gonna continue on with what we were talking about before. I'm gonna give a little bit more basis for our axis, a little more discussion on our axis, and then we'll start getting pretty deep into 12 lead over the course of this term. So for today, we are the end of our last discussion. We started getting into what axis is. So today will be axis part 1, and there'll be a total of 3 different parts that we'll do with axis over the course of this term. So for today, talking about the electrical axis of the heart, let's get into how to work on figuring out the quadrants. And we talked a little bit about this, just a little bit about this at the end of our previous talk. So with the electrical axis, again, remember that the electrical axis is the sum of all of the different positive depolarizing vectors that we have within the heart. All of them incorporate together into a generalized direction for the overall axis of the heart, or the overall electrical activity of the heart. We typically see that from top right to bottom left, and we can break that into P wave, QRS complex, and T wave. So atria, ventricle depolarization, and ventricular repolarization. Each of those have their own axis. We are going to primarily talk about QRS axis for right now. So everything I'm talking about right now is related to ventricular depolarization. So our EKG measures the average of all those vectors together as the signal travels across the heart from that electrode. And remember that electrode we're referring to as a camera. So each camera will have a different view of that electrical current that's traveling in a singular average direction across the heart. Okay. And again, our goal here is to get a 3D picture of the heart when it's all said and done. You'll recall that I asked you to start figuring out this idea of the heart in terms of the circles. So it's a 360-degree circle around the heart. Right now, we are talking about the vertical plane here. So 0 degrees is on the left-hand side of the body, 180 degrees is on the right-hand side of the body. And then instead of going 360 degrees all the way around, we go 180 degrees positive or negative. So 0 to 180 on the positive side travels the bottom of the heart, and 0 to 180 on the negative side travels the top of the heart. And then just remember that each of the cameras are split equidistant from each other. We have 4 leads that produce 6 views of the heart, as we've discussed in the past, which means that we have 6 lines cutting this circle, which creates 12 pieces of pie. And 12 goes into 360 30 times. So 30-degree increments is what we're talking about in terms of each of the degrees of these cameras. So lead 1 is at 0 degrees. Lead 2 is at positive 60. Lead 3 is at positive 120. AVR is at negative 150. AVL is at negative 30. And AVF is at positive 90. All right. Okay, what does axis tell us? It's going to tell us a lot of things as we get going. Anytime we have an abnormal axis, it can let us know that something's wrong, or it can tell us that something is going on with our machine. So anytime an axis is shifted, if you have an infarct of some sort, that will shift the axis, because an infarct, if you have dead tissue, then obviously that tissue will no longer be excitable. And because it's no longer excitable and electrolytes are no longer being transferred, ions are no longer being transferred within that tissue, it means that it is no longer part of the average. Therefore, the axis will shift away from that portion of the heart. Hypertrophy, if you have more tissue that has grown in a particular area, then obviously you'll have more average electrical activity in that area. If you have a conduction delay, like a bundle branch block or something to this effect, if you have some sort of a conduction delay, then it means one portion of the heart will very quickly finish its depolarization, and the other portion of the heart will, wherever the delay is, will have a longer period of time that it's dealing with its depolarization, and therefore the axis will shift towards that conduction delay. And then you can have just movement of the heart, right? If someone is pregnant or obese, their intestinal system is pushing up on their diaphragm, which is pushing up on the heart, and it kind of shifts that heart where the axis is shifted further up to the left, which means the axis in total is shifted to the left. And something like COPD, specifically emphysema, can or anything else that makes them malnourished, can cause their body to not have body fat and can drop the heart, and the heart kind of swings down towards the right. So remember that a vector is any unit of magnitude, and we're adding them all up together to figure out what the average directional flow is. So in this cartoon that you have here, you see that you have one arrow that is diagonally up to the right and one arrow that is mostly down. And based on the proportion of those arrows, you see that the diagonal up to the right arrow is much larger. And so the compilation that you see there is the darker bottom line. This darker bottom line down here is the average where the actual electrical activity is traveling, because that's the average of what these other two are creating. And so that's really what we're talking about when it comes to axis. We're looking at the average of the electrical activity in the heart. Okay. So this might be something that you might see in the heart where you have all these different directions, 1, 2, 3, 4, all of these different ones are all different directions that you see. But we're looking at the average of everything together. So there's 3 components of axis, and we're only going to do the first component for right now. But there's 3 components. One is to break that hexaxial system down into 4 quadrants and then determine what quadrant the electrical activity is most likely traveling through. The second component, which will be our next discussion, is how to actually identify the exact degree axis for those vertical leads. And then the third component of axis is to start looking at the precordial leads, which is something we call the z-axis, and that's looking at it in the horizontal plane. So in our hexaxial system, we have this circle and this cartoon that I've asked you to look at. Each lead has a positive half and a negative half, meaning if we look at the lead and we cut it on the biphasic line from that lead, then anything that's traveling towards that, towards the half that the camera is on would be positive, and anything that's moving away from that half would be negative. So every single camera, we talked about this before, every single camera has a biphasic lead. So for example, if we're looking at lead 1 over here at 0 degrees, then this line that is made up of the 90, -90 line where AVF looks is its biphasic. That means if the electrical activity is traveling towards lead 1 in any way, lead 1 will be positive. So if the electrical activity is traveling in any direction from left to right in this particular cartoon, then we would have lead 1 as being positive. If the electrical activity is traveling the other direction, then lead 1 would be negative. And so you'll get used to, and you'll want to get used to, what are the leads that are biphasic to each other. So lead 1 and AVF are biphasic to each other. Lead 2 and AVL are biphasic to each other. Lead 3 and AVR are biphasic to each other. On the EKG then, a positive vector will be one that is slightly more positive than it is negative, and a negative vector is one that is slightly more negative than it is positive. We would say that a lead is positive even if it is just a tiny little bit more positive than it is negative. So when you're looking at the R wave and the S wave, if the R wave is slightly larger than the S wave, then it's a positive lead. If the S wave is slightly larger than the R wave, then we would call it a negative lead. And we only say positive or negative. And it's just simply based on which is larger, the R wave or the S wave. This is a cartoon that I've shown you in the past, but This shows you where the leads physically are on the EKG. We're not looking obviously at the precordial leads. So V1, V2, V3, V4, V5, V6 are not here, but you do see the lineup that we have here. So this is lead 1, here's lead 2, here's lead 3. This is AVR, AVL, and AVF. And this is how it is situated on a 12 lead. So leads 1 and AVF, depicted by these red line connection right here, those two leads are biphasic to each other. Leads 2 and AVL across from each other are biphasic. And leads 3 and AVR, depicted by this blue diagonal line, are biphasic to each other. So when you're looking at it, there will only be one of these leads that is considered biphasic or isoelectric. It'll be whichever one is the closest to being perpendicular to the actual vector. It'll always be the smallest lead, and it'll be the lead that is as equally positive and negative as possible. All the other leads will be either more positive or more negative, one or the other. And again, any lead that is slightly more positive or slightly more negative is either positive or negative. So again, I talked about this just a moment ago, but if we're looking at lead 1 is cut by the AVF line right here. So if the electrical activity is traveling in the direction of A, in the direction of B, or in the direction of C, then lead 1 will be slightly or significantly more positive than negative, one or the other. If it's B, then it'd be significantly more negative. If it's A or C, then it would just be slightly more positive than it'd be negative. That means if our electrical activity is A, B, or C, our R waves would be greater than our S waves in size. If it is D, E, or F, then our S waves would be greater in size than our R waves, and we would say lead 1 is negative. Okay, so now we start breaking it up into quadrants. You already know that we have our circle set up in 180 degrees. Positive is on the bottom and negative is on the top. So we are going to split our 360-degree circle into 90-degree increments: 0 to positive 90 to 180, and then 0 to negative 90, and negative 90 to 180. Creates 4 quadrants for our circle that we have here. The only 2 leads that we initially need to look at are leads 1 and AVF. They are biphasic to each other, and because they are on the 0 and 90 line, it cuts the circle vertically and horizontally. So if lead 1 is positive or negative, or AVF is positive or negative, those are the only things that we need to look at. So when we look at this cartoon here, looking at cartoon A, lead 1, if we're looking at lead 1, then the blue portion of this circle would make lead 1 positive, and the white portion of this circle would make lead 1 negative. When we look at B, cartoon B, and think of AVF, the yellow portion of this cartoon would make AVF positive, and the white portion of this cartoon would make AVF negative. If we superimpose those 2 circles on top of each other, then lead 1 is still positive on this blue half, and AVF is still positive on the yellow half. And so now we have the best way to look at which quadrant our electrical activity is. If we have a situation where lead 1 is positive, but AVF is negative, then we have to be in this quadrant that goes from 0 to negative 90. If both lead 1 and AVF are positive, then we have to be in this green portion of our quadrant, so from 0 to positive 90. If it's in this yellow quadrant, we have lead 1 as negative and AVF as positive, then we'd be in the 90 to 180 quadrant. And if lead 1 is negative and AVF is negative, then we would be in this white quadrant, which is from negative 90 to the 180. So that's how we can split up each of the quadrants just by looking at leads 1 and AVF. If you look at leads 1 and AVF, you can tell where the electrical axis is actually coming from. So again, we look at those quadrants, and then we have to provide some sort of a name. So we know that in most people, our electrical activity is traveling from top right to bottom left. So most people will have a normal quadrant in the bottom left. Remember that when I talk about this circle, I'm talking in relation to a patient looking at you, which gives us the rise to right and left. It's based on the patient's side. So then our normal axis is in that bottom left towards the apex. Both leads 1 and AVF would be positive, and that tells us that the axis is down in the normal quadrant. The blue quadrant, where lead 1 is positive and AVF is negative, would be the left quadrant, depicted by the blue quadrant there. The yellow quadrant, where lead 1 is negative and AVF is positive, is what we refer to as the right quadrant. And if both lead 1 and AVF is negative, then we refer to that as the extreme right quadrant. Any axis that is not in the normal axis, with one caveat that I'll discuss in just a minute, should be referred to as abnormal. And the way that we discuss that is that if the activity is in the left or in the right or extreme right, we call it a deviation. So we would say if lead 1 is positive and AVF is negative, we would say we have a left axis deviation. If lead 1 is negative and AVF is positive, then we would say we have a right axis deviation. So again, when we're looking at these different quadrants here, if we see that lead 1 is positive and AVF is positive, then we would be in the normal axis. If we have lead 1 is positive and AVF is negative, then we would be in the left quadrant, and we would say this person has a left axis deviation. If we have a negative lead 1 and a negative AVF, we're only referring to the QRS complexes right now, a negative 1 and a negative AVF, we would say we have an extreme right axis deviation. And if we have a negative lead 1 and a positive QRS in AVF, then we would say we have a right axis deviation. Okay, and then it's not quite all. We do have to look at one aspect of this that is normal, but outside of what we refer to as normal. So we've split up the 4 quadrants with normal, left, right, and extreme right. However, a person can actually be normal with an axis from -30 to as much as +110. It's that 0 to -30 that is of most interest to us. So if somebody has an axis that falls in the 0 to -30 range, it is not in the normal quadrant, but it is still normal in terms of the person, and in terms of a person being normal. So we actually will split the left quadrant into what we refer to as physiologic or pathologic. And the line that splits that is the -30 line. So if we have an electrical axis that is between 0 and -30, then we would say they have a physiologic left axis deviation, which is another way of saying a normal left axis deviation. If, on the other hand, they are from -30 to -90, then we would say they have a pathologic left axis deviation, and that means there is a problem. The 0 to -30 would not necessarily denote a problem, but the -30 to -90 would. So we have an easy way to figure that out, actually, because the 0 to -30, that -30 is the AVL line, and lead 2 being down here at +60, lead 2's biphasic is AVL. That means the AVL line will determine the positive or negativeness of lead 2. So when we look at lead 2, this blue portion of the circle, lead 2, would always be positive, and this white portion of the circle, lead 2, would always be negative. We're only interested in this one little quadrant here, but notice that from 0 to negative 30, lead 2 would be a positive lead, and from negative 30 to negative 90, lead 2 would be a negative lead. So in the situation where you have looked at leads 1 and AVF and determined that lead 1 was positive, and AVF was negative, then you would be in the left quadrant from 0 to negative 90. That's great. We would say they have a left axis deviation, but that's not quite enough. Now we need to know, is it a physiologic or pathologic left axis deviation? So then we look at lead 2. If lead 2 is positive, then we have a physiologic left axis deviation. And if lead 2 is negative, then we have a pathologic left axis deviation. All right, so a quick recap here. When we look at our quadrants, we can break it into the 4 quadrants just by looking at leads 1 and AVF. If both of them are positive, we have a normal axis. If both of them are negative, we have an extreme right axis deviation. If lead 1 is negative and AVF is positive, we have a right axis deviation. For those 3, that's all we need to know. If, however, we have a positive lead 1 and a negative AVF, it means we have a left axis deviation. If we have a left axis deviation, we will go one step further and we will look at lead 2 to determine if it is physiologic or pathologic. If lead 2 is positive, then we know that it's in that 0 to negative 30 sliver, and we would say it's physiologic left axis deviation. And if it is in the negative 30 to negative 90, then we would say that it is a pathologic left axis deviation. Okay, that ends part 1 of axis. I'm going to give you guys some 12 leads to do, which I'll have for you later this week, that you can go through and start looking at nothing but axis quadrants and try to figure out which quadrants are normal, left axis, right axis, or extreme right axis. And if they are left axis, you'll determine if it's physiologic or pathologic. All right, so let's find out what kind of questions you have. I will give you an opportunity to talk to me this week and find out what questions come up with this. We'll start looking at the axis, and then we'll take that into ST changes, and the first thing that we'll jump into is looking at bundle branch blocks as well. All right, end of axis part 1.